Hello and welcome to your monthly update from the COVIDENCE UK study. My name's Adrian Martineau and I'm based at Queen Mary, University of London. So today I just want to update you on a story that's been circulating in the press over the last few weeks. And it's an interesting story around composition of flu virus vaccine for use in the southern hemisphere for their winter season. Now, it relates not actually to SARS-CoV-2, although there is relevance, as you're about to find out, but to influenza virus. And so I thought I'd start this little talk by updating you or refreshing your memories about types of influenza virus, which are named A, B, C, and D. Now, working from the bottom, influenza virus D primarily affects cattle and pigs, so we don't have to worry about it too much as a human pathogen. And influenza C tends to manifest as a relatively mild infection, primarily in children, so it's not something that we routinely vaccinate against. By contrast, flu A and flu B are the causes of seasonal epidemics, and so flu vaccines contain vaccines which vaccinate against these two variants or types. Now, within flu A and flu B viruses, there are different subtypes or lineages respectively. So within flu A, there are actually more than 130 subtypes, and these are based on two proteins called H and N, which are expressed on the viral surface. Two of the common combinations are H1N1 and H3N2, just to give you a flavour for how those flu A subtypes are written down. By contrast, flu B simply has two lineages, which are called respectively B Victoria and B Yamagata, which is the lineage of interest for this talk. Now, flu vaccines try to cover different subtypes or lineages of flu virus by including protection against 4 different viruses. Classically, 2 influenza A subtypes, for example, H1N1 and H3N2, and both of the influenza B lineages, B Victoria and B Yamagata, and they're called quadrivalent because they can protect against 4 flu viruses. Now, what's interesting and a first is that the World Health Organization, in its latest guidance for the flu season in the southern hemisphere, which is covers the autumn and winter of 2024 over there, which corresponds to a northern hemisphere spring and summer, they are recommending that the B Yamagata antigen in the quadrivalent vaccine is no longer warranted, and every effort should be made to exclude this component as soon as possible. Now, this is something of a first, and the reason for it is very interesting and is illustrated here in this graph from a paper by Koutsakis and colleagues published in Nature Reviews Microbiology. Now, what you can see along the x-axis, the horizontal axis here, is the date, and here you can see basically the number of cases of different viruses that have been isolated within a given geographical area. And what you can see is that up to March or April 2020, all 4 of these colours are represented. But after that, which was obviously coincides with the onset of the COVID-19 pandemic, we're just seeing blue, purple and yellow bars, and this orange or reddy bar representing B Yamagata has disappeared. And the thinking is that the reason it's disappeared is because of public health measures that were taken in response to the COVID-19 pandemic, which basically, as we all know, reduced transmission of viruses, including SARS-CoV-2, but also including rhinovirus and flu viruses. And this basically dramatic reduction in viral transmission resulted in the elimination of one of the lineages of flu B. So why does it matter? 2 reasons, really. This is the first time that an influenza virus has been eliminated from the human population through non-pharmaceutical interventions, by which I mean behavioural changes like mask wearing, reducing social mixing. And what it tells us more generally is that what we kind of assume to be the immutable status quo, whereby respiratory viruses are going to continue circulating whatever we do, is not inevitable, and that actually the public health interventions that we can put in place can actually have a significant effect on the profile of respiratory viruses that circulate. So the bottom line from this little story, I think, is that simple things such as universal sick leave for anyone with the respiratory symptoms could make a difference to what viral pathogens circulate in the community. And moreover, now that there's one less of those pathogens to worry about, this provides an opportunity for simpler and less costly seasonal flu vaccine campaigns. And it also opens the door to inclusion of other lineages to provide broader coverage now that we no longer need to cover for Yamagata B. And so I hope that little vignette has been of interest, and next time in April we'll have a talk, I hope, from Giulia Vivaldi, our lead statistician, who's currently just finishing off an analysis of your latest data, looking at the impact of delay from vaccination to severity of symptoms, particularly in populations who haven't been qualifying for COVID vaccination in recent months. So we hope to have that for you next time. But in the meantime, thank you as always for completing your questionnaire, and I look forward to seeing you again in April. Goodbye.